So next topic is clinical features of conjunctival inflammation. So the symptoms will be the non-specific symptoms include lacrimation, grittiness, stinging and burning. In allergic disease there will be itching. Although itching may also occur in blepharitis in lesser extent and dry eye syndrome. In conjunctival inflammation, the visual acuity is usually not affected. If there is conjunctival inflammation with significant pain and photophobia or a marked foreign body sensation, it suggests corneal involvement. The next is inflammation clinical features discharge. The discharge may be watery, it may be mucoid, it may be mucopurulent, moderately purulent and severe purulent. Watery discharge occurs in acute allergic conjunctivitis and acute viral conjunctivitis. The watery discharge contains serous exudate and tears. Next is mucoid discharge. Mucoid discharge occurs in chronic allergic conjunctivitis and dry eye. Next is mucopurulent. It occurs in chlamydia and acute bacterial infection. Moderately purulent in acute bacterial. Severe purulent gonococcal infection. Conjunctival reaction. Conjunctival reaction, there may be hyperemia, there may be hemorrhages, there may be chemosis, membranes formation, infiltration of the conjunctiva, subconjunctival cicatrization, follicles, papillae. The first one is hyperemia. It is diffuse and beefy red, more intense away from the limbus, seen in bacterial infection. This conjunctival injection, it should be distinguished from ciliary injection of iridocyclitis. So conjunctival hyperemia, it is a vasodilatory response. Next is hemorrhages. Occur in viral conjunctivitis. They are multiple, small, discrete, known as petechial hemorrhages. They are severe in bacterial conjunctivitis. In bacterial they are larger and diffuse. Next is chemosis, also known as conjunctival edema. Seen in it is a translucent swelling. It may protrude through the eyelids. If it is acute, it indicates hypersensitivity response, for example to pollen, but can also occur in severe infective conjunctivitis. If it is subacute or chronic, it has numerous causes. For example, the local causes are thyroid eye disease, chronic allergic conjunctivitis, ocular or eyelid surgery, trauma. Another cause of chemosis is increased systemic vascular permeability. It occurs in allergic conditions, also in infections such as meningitis, vasculitis. Another cause of chemosis is increased venous pressure. It occurs in superior vena cava syndrome and right side heart failure. Another cause of chemosis is decreased plasma oncotic pressure, for example in nephrotic syndrome. Another conjunctival reaction is membranes. Membranes may be pseudomembranes and true membranes. Pseudomembranes consist of coagulated exudates. Coagulated exudates, they are adherent to the inflamed conjunctival epithelium. The pseudomembranes can be peeled away and they leave underlying epithelium intact. And then there is true membranes, which involve superficial layers of the conjunctival epithelium. Attempted removal leads to tearing. The true membrane and the pseudomembrane distinction is rarely clinically helpful. Both can leave scarring following resolution. The causes include severe adenoviral conjunctivitis and gonococcal conjunctivitis. Other bacterial conjunctivitis such as Streptococcus, Corianbacterium diphtheria, ligneous conjunctivitis, and Stevens-Johnson syndrome. Another conjunctival reaction is infiltration. It represents cellular recruitment to the site of chronic inflammation. It accompanies a papillary response. There is a loss of detail of the normal dorsal conjunctival vessel and especially on the upper lid. Here you can see infiltration and there is loss of detail of normal dorsal conjunctival vessels. Another reaction is subconjunctival cicatrization or scarring, occurrent trachoma. Other causes is severe form of conjunctivitis. Severe scarring, there is loss of goblet cells and there is loss of excessively lacrimal glands, so which lead to cicatricial and also it can lead to cicatricial entropion. Another important reaction is follicles. The follicles are multiple, they are discrete, they are slightly elevated lesions, they look like translucent grains of rice. They are prominent in the fornix. The important point is that blood vessels run around or run across the lesions. In the follicles, the blood vessels do not cross within the lesion. So this distinguishes it from papillae, where the blood vessels lie within the lesion. So histologically, there is subepithelial lymphoid germinal center, lymphoid. There is central immature lymphocytes and mature cells peripherally. What are the cause of follicles? The first cause is viral conjunctivitis. Second cause is chlamydial conjunctivitis. Third cause is perinode oculoglandular syndrome. Fourth cause is hypersensitivity to topical medications. But keep in mind that small follicles are normal finding in childhood, called folliculosis. Follicles in the fornix and at the margin of the upper tarsal plate in adults are also common. Now the papillae. They are important. Develop in the palpebral conjunctiva, only in the palpebral conjunctiva, and in the limbal bulbar conjunctiva it is attached to the deeper fibrous layer. So they develop only in the palpebral and limbal bulbar. The differentiating point from follicle is there is a vascular core. A vascular core is present. There are micropapillae and macro. The micro are in the mosaic-like pattern or elevated red dots as a result of central vascular channel. while the macropapillae, which are less than 1 millimeter. There are also giant papillae, more than 1 millimeter. Giant papillae develop with prolonged inflammation. There is apical infiltrate or staining with fluorescein or presence of mucus with marked activity. Limbal papillae have a gelatinous appearance. Now, what are the causes of papillae? The first cause is bacterial conjunctivitis and allergic conjunctivitis. Another cause is allergic conjunctivitis, chronic blepharitis, contact lens wear, superior limbic keratoconjunctivitis, and floppy eyelid syndrome. So in bacterial there is papillae and viral there is follicles. Thank you very much.